Hello, good morning. We'll wait for a few minutes so that others join. No. Can you hear me? Hello, can you hear me?
Yes, nice able to hear you.
Okay. So we will start in another 2-3 minutes. 10 more students need to come. Okay, so we'll start the class. So this re-education chapter is just a summary of all the techniques you will be learning in therapeutic skills 1 and therapeutic skills 2. Okay, so it is 1 minute. So it is something like a summary, something like the complete therapeutic skills subject. Is that clear? So as a sample, we'll just take 2 or 3 muscles and we will just see. You will be discussing about within yourself. Then we'll have a discussion. Uh, like after maybe in the break room, we'll have a discussion. Okay. So I'll just summarize about last class 1. So whenever you have muscle power 0, so that means either the muscle will be in flaccid stage or the muscle will be in flaccid stage. So we have seen in last class that when you have a upper motor neuron lesion, then you will be having the muscles will be in spastic and the muscle may be in 0. And if you have a lower motor neuron lesion, then you may have the muscle will be in a flaccid stage. Okay, so whatever may be the condition of the muscle. So when you want to improve the muscle from 0 to 1, if you want to increase the muscle power from 0 to 1, or if you want to initiate the muscle contraction, then you can go for this technique. That is, you need to increase the sensory input. So this increase in the sensory input can be done by splinting. So let me show you what is splinting. So these are the splinting. So this is something called wrist splint. So where you will be like, where like you can just this is called wrist splint, where you will be stopping the movement in the wrist. So can you make out? So you will be the inside one, this black strap will be having a aluminum rod or aluminum plate, so that it is just stopping the movement, that is stopping your wrist flexion and extension. Is that clear? So you will be having an aluminum plate here. Then you will be, this aluminum plate will restrict your wrist flexion. And with the help of the straps, it will also restrict your wrist extension. So this is called as splint, or you can also say call it as braces. So here if you see, like this is called POP plaster or plaster of Paris plaster. So with the help of it, for example, people who are having a contracture in the knee joint, So the knee, if you want to do stretching and increase the muscle length, then you can use this kind. Or if you have a flaccid calf muscle, so where you will not, if you have problem with your dorsiflexors, if you're not able to use your dorsiflexors, or if the dorsiflexor muscles are weak, then you will not be able to you will not be able to maintain the leg in neutral position. Instead, because of the gravity, the leg will go for foot dropping. So to prevent that, you can also give a splint like this. This is called POP splint. So this can be this is a fiber optic splint. So this is called as AFO, ankle foot orthosis. Okay, so this is also same thing, used for the same thing. So to prevent, so this splinting is done to prevent the muscle going into deformity. So whenever one muscle group is weak, the other muscle group will, or the antagonistic muscle will go for more movement, and it will go for contracture. So that will lead to deformity. So all these things you will be learning in your ortho. Okay, don't think that I'm just brushing a little bit. So this is just to make you understand what it is. Okay, so in detail you will be learning in your ortho and neuro. Is that clear? So when to this splinting and braces are used to prevent deformity whenever a muscle is in uh, zero power or muscle power 1. So why you want to prevent deformity? If a muscle is in 0 or muscle power 1, then the opposite muscle group will overact, and it will lead to contracture, and it will lead to deformity. So till the muscle is improving, you will be keeping this muscle in splinting like this. So this is another one. This is another one which is called as knee braces. So here, if you see, if you want to completely arrest the lower limb movement, that is in the hip, in the knee and in the ankle, then you can go for this kind of splint, where you will not have any movement in the knee as well as in the ankle. So here, if you see, this is a kind of a knee brace where you can fix till what degree you can flex, or till what degree you want to do the movement. So if till 10 degree or 20 degree, if you want to do the movement, you can fix that degree here, and the brace will allow movement within that degree. Is that clear? So these are the different types of splints and braces which will be used, like which will be used when the muscle power is 0 or muscle power 1, to prevent deformity and to maintain the muscle length. Otherwise, because if a muscle is in 0, it will take little longer time to improve the muscle power. You cannot just increase in 1 or 2 days. So it will take some time. So till that time, this splinting and braces will help you to maintain the muscle length and muscle property, prevent wasting, and prevent deformity. Okay, so this one you will be doing when you have muscle power 0. The next is passive movement. I hope all of you know how to give passive movement. So I'm not going in detail of that. Then you can give uh, electrical stimulation. So this electrical stimulation also theoretically you would have learned. Practically now I will just show you one video to see how it works. Okay, then PNF, which we are going to see in the later time. Okay, so this is in muscle power 0. When the nerve is intact and the muscle is in muscle power 1 and 2, then again you will be giving passive movement, then electrical muscle stimulation. Okay, then brief icing, brushing, quick stretch, approximation. All these we will see now in a video. Hydrotherapy we have already seen. So I hope you know what is isometric exercises. Okay, so let me just show you the video uh, to that will be explaining about EMG, like electrical muscle stimulation, brief icing, brushing, quick stretch, all those things. See, this quick stretch, icing, stretching, I did not get a exclusive video, but I have just taken from some other technique. So it is called as roots technique. So this roots technique, about this roots technique, you will be learning in your neuro, okay, later. But I have just taken the video from that. So first we will see about electrical stimulation. So this is one way of giving electrical stimulation. You have many methods to give electrical stimulation, using a pen electrode, using a plate electrode, all those things. So this is using a plate electrode.
In preparation for electrical stimulation, we are going to clean the area for pad application. So I'll use a little alcohol swab, clean the oils and the dead skin off of the region. Up here.
The video is quite laggy.
For muscle stimulation, we'll apply the pads over the muscle belly.
Come again?
Miss, the video is quite laggy.
Okay. Video is lagging now. Just a minute, okay? I'll reset my internet and come back. Okay, check again.
In preparation for electrical stimulation, we are going to clean the area for pad application. So I'll use a little alcohol swab.
Is it okay now?
Clean the oils and the dead skin off of the region. Up here.
I think no, Miss.
For muscle stimulation, we'll apply the pads over the muscle belly parallel to the direction of the fibers. Okay. Patrick, where you're going to be feeling is beginning of a tingling. Eventually the muscles will begin to pulse, And what we want is a strong muscle contraction, as strong as you can tolerate. Okay. All right, Patrick, what you're going to start feeling is some tingling as I start the device, and then some gentle muscle contractions, and eventually a very strong muscle contraction. We are going for muscle strengthening here, so we want as strong as a contraction that you can tolerate. It may be a little bit uncomfortable, but it shouldn't be painful. Okay? Okay. Okay, Patrick, I'm going to start the unit. You're going to start to feel some tingling. Let me know when you begin to feel that. Our goal is to get your knee straight down to the bottom of the table, to the back of the table. Start feeling it now. Okay, so you're beginning to feel some tingling. We're going to keep ramping it up. We want a strong muscle contraction. Okay, so you're beginning to see the muscle contraction there. Is that comfortable for you? Mm-hmm. Can you tolerate more? You can go ahead. Okay, and when you feel that, I want you to actually activate your muscle with it. There. Okay, right about there. Good. I'm going to start the unit. And it is going to be on for 10 seconds. When it's on, I want you to...
Okay, so can you see this? So the pads are fixed over the muscle belly, and one will be over the insertion or origin. So when you are giving the electrical stimulation, so when the current is going beyond certain limit, then you will get a muscle contraction, okay, flickering muscle contraction. So you can set how many seconds you want that and how many contractions you want. All those things you will be able to set. Is that clear?
Activate your muscles, and then it'll be off for 50 seconds where you can relax. Perfect. We're going to be doing 10 repetitions of this over the next 10 minutes.
Okay. So
now that the treatment is completed, we'll remove the pads carefully.
So you will be learning this electrical stimulation more when you are coming back to campus. Okay, so theoretical aspect of Electro 1. Is that there? Okay. So next is... So here you will be seeing a complete facilitating technique. Actually, this is a particular technique called roots. So this technique is used to facilitate a particular muscle. So facilitate a muscle contraction. That means like initiate a muscle contraction.
Hello and welcome to Physio Classroom. This is our fourth lecture on roots के अंदर specially जिनको हाई हैं. तो आइए जानते हैं पहली टेक्निक के बारे में. This technique is known as light moving touch. All you need to have is your fingertips, or you can also use a camel hair brush. आपको सबसे पहले एक डर्मेटोम आइडेंटिफाई करना है. वो डर्मेटोम का सिलेक्शन आप कैसे करेंगे? It will depend upon which muscle you want to activate. Like for example,
okay, so this video is of different language. You just ignore the talks. You can just see how they are doing it. Okay.
आपके पेशेंट में you see कि पेशेंट के ट्राइसेप्स में एक्टिवेशन नहीं है. So you will select the C7 dermatome. Now you need to apply your fingertips over that dermatome in this fashion for 3 to 5 repetitions. After this, you have to take a break of 30 seconds and wait for the muscle to respond, and during that time you need to give some activity to the patient so that there is cortical facilitation as well. जब आप इस टेक्निक को यूज करते हैं तो इससे इम्प्रूवमेंट कैसे आता है, व्हाट इज द फिजियोलॉजी बिहाइंड इट? So the stimulation here is the slow moving or light moving touch. This stimulation is perceived by the hair and organs and the free nerve endings that are present in your skin, and this stimulation is transmitted to the spinal cord via the A delta fibers. From the posterior horn of the spinal cord, this information is transferred then to the anterior horn, and via the alpha motor neuron by roots is known as fast brushing.
Okay, so the first facilitating technique is light touch. So this light touch is normally done for spastic muscle from origin to insertion. Is that clear? So when you have a flaccid muscle, then you have to go for fast touch. So normally this light touch is done for spastic muscle to initiate the contraction. So next is like fast brushing. So this fast brushing is done for flaccid muscle. So whenever you are doing for flaccid muscle, you need to do from distal to proximal.
इसका application एकदम same है as that of the light moving touch. All you need to have is a rotatory hair brush which is easily available in market, or you can also use a brush which has thick strands. इसको भी आपको similar fashion पे उन डर्मेटोम्स पर अप्लाई करें जिसके मसल्स या रिलेटिव मसल्स को आपको स्टिमुलेट करना है। एक खास बात इस टेक्निक की ये है कि इफ यू यूज फास्ट ब्रशिंग, इट विल नॉट ओनली एक्टिवेट द मसल्स, इट विल आल्सो हेल्प यू टू इम्प्रूव द सेंसरी फंक्शंस इन योर पेशेंट। पेशेंट की कॉर्टिकल एक्टिविटी इंप्रूव होती है बिकॉज द एफरेंट हियर इज द सी फाइबर which also sends collaterals to the reticular activating system present around the brainstem, और पेशेंट के कॉन्शियसनेस लेवल को बढ़ाने में भी आपको इन योर ब्रेन अराउंड द ब्रेनस्टेम आपको इसमें भी हेल्प। और अ पीस ऑफ क्लॉथ एंड स्वाइप एंड आस्क द पेशेंट टू परफॉर्म 3 quick swipes. You need to have an ice cube and you can hold the ice cube using, तो ये टेक्निक आपको इसमें भी हेल्प करेगी। The third technique that we are going to discuss is known as A-icing.
Okay, so the second technique is brushing. So brushing, you can do fast brushing when you have a flaccid muscle. So you have to do from distal to proximal. Distal to proximal means like you need to go from insertion of the muscle to origin of the muscle. So that is distal to proximal. So in case like if the person is having spastic muscle, then you have to do a slow brushing from proximal, that is from origin to insertion. Okay, so this will help you to initiate the muscle contraction. The next technique is icing. So this is also, you have a quick icing and a slow icing or prolonged icing. So you will be doing prolonged icing for patient who have a spasticity, and you will be doing a quick icing for patient who has a flaccidity.
It is also called as quick icing. In this technique, you need to have an ice cube and you can hold the ice cube using a gauze or a piece of cloth, and you have to apply it on the target muscle over the overlying skin for 3 quick swipes. And you have to immediately wipe the water using a handkerchief after the swipe and ask the patient to perform the activity that you think can facilitate the muscle contraction. क्विक आइसिंग से आप मसल कॉन्ट्रैक्शन को इम्प्रूव तो करते ही हैं, साथ ही बिकॉज दिस टाइप ऑफ फैसिलिटेशन इज मीडिएटेड बाय द ए फाइबर्स and the information ascends up to the level of the brain, there is also an autonomic reflexive activity that is generated by this technique. The fourth technique that we are going to discuss is known as C-icing. This technique is used mainly to activate the postural or the anti-gravity muscles in the patient. अगर आपके पेशेंट के अंदर हेड कंट्रोल पुअर है, सिटिंग में पेशेंट आपका ढंग से नहीं बैठ पा रहा है, तो आप इस टेक्निक को यूज़ कर सकते हैं। इस टेक्निक को यूज़ करने का तरीका सिंपल है। आपके पास एक आइस क्यूब होना चाहिए और आपको उसको डिज़ायर्ड डर्मेटोम के ऊपर प्रेशर के साथ एटलीस्ट फॉर 30 मिनट्स तक रखना होता है। ये टेक्निक सी फाइबर्स को स्टिमुलेट करती है। आप इस टेक्निक से पेशेंट की मेंटल अलर्टनेस को भी बढ़ा सकते हैं और उसकी एंटी ग्रेविटी मसल की टोन को भी आप इंप्रूव कर सकते हो. द फिफ्थ फैसिलिटेटरी टेक्निक गिवन बाय
Okay, so this is this next technique he explained is the prolonged icing, where you will be keeping the ice cube for on a particular muscle for a long time to reduce the spasticity.
Roots is known as approximation. इस टेक्निक को आपने भी कई बार अपने पेशेंट्स में यूज किया होगा. इस टेक्निक के लिए आपको पेशेंट को किसी भी एक डेवलपमेंटल पैटर्न में ले जाना है और उसके जॉइंट को ईदर मैनुअली और यूजिंग वेट कफ्स या सैंड बैग आपको जॉइंट को अप्रॉक्सीमेट करना है. इससे जॉइंट के प्रोप्रियोसेप्टिव्स स्टिमुलेट होते हैं और इसकी वजह से जॉइंट की स्टेबलाइजिंग मसल्स के अंदर टोन इंप्रूव होती है. तो पेशेंट की जॉइंट की स्टेबिलिटी को इंप्रूव करने के लिए आप इस टेक्निक को यूज कर सकते हो. द नेक्स्ट टेक्निक गिवन बाय रूट्स इज कॉल्ड एज वाइब्रेशन. इस थेरेपी को यूज करने के लिए यू नीड टू हैव एन इलेक्ट्रिकल वाइब्रेटर and you should ensure that it gives a frequency of 100 to 200 cycles per second. इसका स्टिमुलेशन टेक्निक भी सेम है. आपको डर्मेटोम को स्टिमुलेट करना है so that you get a myotomal response. जो चीज़ आपको ध्यान रखनी है वो ये है कि you should not give it for more than 1 to 2 minutes at a time because vibration produces a lot of heat and friction in the skin. The next facilitated technique that we are going to discuss is stretch. Stretch has been further subclassified into 3 types: intrinsic stretch, secondary ending stretch, and stretch pressure. Intrinsic stretch refers to the stretch that is given to the intrinsic muscles of your hand. For delivering this technique, you need to bring the patient prone on elbows. ये टेक्निक आप यूज करते हैं especially when you find that in your patient the shoulder stability is lacking. इस टेक्निक को करने के लिए आप कोई भी एक ऑब्जेक्ट ले लें जो पेशेंट के हाथ में आराम से आ सके और उसका हाथ रिलेटिवली ओपन रहे. He should be in prone on elbows position and the more weight has to be borne on the ulnar side. Now ask the patient कि उस ऑब्जेक्ट को वो बहुत ही टाइटली ग्रास्प करने की कोशिश करे. So इससे होगा क्या? The intention is to clinch the fist, to bring the fingers closer to your hand. But because you have placed a firm object, the muscle spindle will remain relatively lengthened. So therefore, actually the intention is to contract, but the end result is a relative lengthening of the muscle spindle. This is going to activate the proximal shoulder muscles and you will find that in your patient you are getting a better shoulder stability. The second type of stretch is known as secondary ending stretch. इसको करना बहुत ही इंटरेस्टिंग है and इसको करने के लिए all you need to do is you ask the patient to do a movement, you give resistance to that movement, you let the movement happen for some time, after that you increase the resistance. So what you are actually doing is you're allowing the muscle to contract. The intention is to contract, but after some time even a contracting muscle starts lengthening. That is, you are increasing the resistance and challenging the patient. इससे होगा क्या? जो next contraction या जो next effort patient का आएगा, that will be even more powerful because now the patient has a feedback that he needs to improve the effort from his muscle. The third technique in stretch is known as stretch pressure. To deliver this technique, you need to utilize your index finger, your middle finger and your thumb. First, you need to palpate the tendon of the muscle that you need to activate. Now, you need to deliver a downward pressure over the tendon using the 2 fingers and the thumb. And now, while keeping the 2 fingers stationary, you need to move the thumb away from the finger. This is going to activate the muscle spindle and going to produce an increased contraction from the muscle. The 8th and the final technique in this series is known as proprioceptive facilitatory technique. In this, the first subcomponent of it is resistance. Now resistance can do wonder in physical therapy. If you apply resistance properly, you will not only improve the muscle strength of the patient, but you will also motivate the patient to work harder. रेजिस्टेंस किस तरह से अफेक्ट करता है आइए समझते हैं. जब आप किसी भी मसल को जो इनएक्टिव है या जो वीक है आप रेजिस्ट करते हैं तो वो मसल शॉर्टनिंग में जाती है. व्हेन द मसल गोज इनटू शॉर्टनिंग द स्पिंडल ऑफ द मसल also shortens relatively, and when you stretch a muscle spindle that is shortened it will lead to a better facilitation of that muscle. The second subcomponent in proprioceptive facilitation is known as tapping. You can use this technique using your hand. आपको इसके अंदर करना ये है कि you have to apply.
Okay, so facilitating technique we will be seeing in from next class or
3 to
maybe
5
from this
quick
class.
repetitions of
You
tapping
just see
over the
the
dermatome.
technique
जिस भी मसल को आप एक्टिवेट करना चाहते हैं you use a particular function, ask the patient to do that activity, and when the patient is doing that activity you give a quick tap over the muscle that you want to facilitate. The third way of giving.
Okay, so do you remember about this tapping? So if you see all the technique, they will be doing in unilateral only. They will not be doing bilateral. So you will be doing unilateral from either from distal to proximal or from proximal to distal. Okay, so that's how they will be doing it. And this tapping we already saw in suspension. So when they are doing the movement, we need to tap so that the muscle is getting initiated.
Proprioceptive facilitation is by using vestibular stimulation. Vestibular stimulation को देने के लिए आपको हेड और नेक को डिफरेंट प्लेन्स में मूव करना है. That is, you can move the head and neck in the transverse plane by giving the side rotations. You can move the head and neck in the sagittal plane by moving the head and neck up and down, or you can also move the head and neck in the frontal plane by moving the neck sideways. आप तीनों प्लेन्स को यूटिलाइज करके सर्कमडक्टरी मोशंस के थ्रू भी वेस्टिबुलर स्टिमुलेशन कर सकते हैं. वेस्टिबुलर स्टिमुलेशन के बारे में रूट्स ने बहुत ही इंटरेस्टिंग बातें कही हैं. रूट्स फाउंड आउट दैट इवन बिफोर पेशेंट के अंदर स्ट्रेच रिफ्लेक्स एक्टिवेट होता है. लाइक फॉर एग्जांपल, there are many times that you see patients who are totally hypotonic and are areflexic. In such type of patients, what you can do is you can start with vestibular stimulation. Vestibular stimulation activates the anti-gravity muscles even before the stretch reflex. The other benefits of vestibular stimulation are it helps in the improvement of tone, improvement of balance, protective responses, cranial nerve functions, because you are stimulating the 8th cranial nerve which is indirectly stimulating your brainstem. एक और खास बात जो वेस्टिबुलर स्टिमुलेशन की है, इट हेल्प्स इन द बायलैटरल इंटीग्रेशन, बिकॉज यही एक ऐसा स्टिमुलेशन है जिसमें आप एक साथ दोनों हेमिस्फीयर्स को स्टिमुलेट कर पाते हैं. द लास्ट कंपोनेंट इन प्रोप्रियोसेप्टिव फैसिलिटेशन इज इन्वर्जन. You must have heard about the inversion therapy. There are many ways that you can impart this therapy, but the cheapest way is to use a couch in such a manner that it is tilted at least 60 to 70 degrees. You make the patient lie down prone with the head facing downward. Now, inversion produces static vestibular stimulation, which is thought to improve the tone in the extensor muscles of the body. If you do inversion therapy for a shorter period of time, it will lead to stimulation of these muscles and patient can have better control of head and neck, trunk and limb extensor. Please don't forget to like this video. Also, if you have any queries, please put your comments below.
Okay, so we are not going to use all the techniques whatever he has explained. So you just take the technique whichever is explained in the slide. Okay, so that technique alone you have to watch how they are doing it. Next is so you watch one more video so that like you'll get little more idea about the proprioception procedures. Okay, so this is compression, or you can also say this is weight bearing. Intrinsic stretch means internal muscle stretch. Intrinsic stretches. Can you check how is the video now? She is using the mobile in vibratory mode, but actually we should not use that. Okay, so many of the techniques you will be learning in neuro pediatrics. Okay, so don't worry about don't worry if you don't understand the concept behind that, because concepts you will be learning in detail in your neuro 1, neuro 2 and pediatrics. Okay. So any doubt so far? Can we go to the questions? Okay, so these are the questions for discussion. Okay, but I think like we will take up the second question alone, and we will divide into 5 groups. Okay, so we will take up the second question alone. Okay, so if it is not clear, I'll send you the question through WhatsApp. So we will take up the second question alone. Then we will be dividing into 5 groups. So one group 1 will be discussing about the techniques used to improve the muscle power from 0 to 1. Then 1 to 2, 2 to 3, 3 to 4, and 4 to 5. So here they have given the whole of upper limb. So instead like okay, so we can go with whole of upper limb also. Okay, so I will be dividing you into 5 groups, and I will just post this question in your WhatsApp group, so you can read the question and discuss. So this is the discussion. Okay, so the person is having a flaccid upper limb weakness. Okay, that means the completely right upper limb is flaccid. So no movement in the right upper limb, and you need to discuss what are the techniques you will be using from 0 to 1, 1 to 2, 2 to 3, and 3 to 4, and 4 to 5. Is that clear? So now I will divide you into 5 groups. So I think 15 minutes is more than enough, right? Are you able to hear me? Okay. So now I will divide into 5 groups. Please join as soon as possible. Okay, join as soon as possible. Okay, so how many of the group really had a discussion? I went through few of the break rooms, but two break rooms there was no discussion. See, when we give time, like you need to discuss, like don't waste your time. Is that clear? So can I have the first group to come up?
Miss.
Yes.
First group,
Hmm.
it's from 0 to 1, right?
Yes.
So I'll be talking about, I'll just give an example of what 0 to 1, how to increase the muscle
What are the techniques to just
techniques. So firstly, we can apply is, so we need to initiate the muscle contraction. So this we can try to increase the sensory input. And firstly, can be using sprinting and also sprinting and also bracing on the upper extremity of the hand. And this helps to prevent muscle wasting and also helps with maintaining the muscle length. And then next we can also use cutaneous stimulation such as tapping and also brushing. And this, because since it's flaccid, so we use from distal to proximal. And then after that we can go for electrical stimulation, which this one use indirect current. Yeah, sorry, interrupted direct current. And then lastly we can also use uh, can also use passive movement and PNF, which also use from distal to proximal. So from the whole right upper limb, such as the fingers, wrist, and elbow and shoulders. Yeah, that's all.
Okay. So others, any doubt or you want to add up anything? Okay, so when since this case is a flaccid case, when you are giving, you need to start all the technique from distal to proximal. Is it clear? Okay, so the next group.
Hello, Miss.
Yes.
Yes, okay, can hear. All right. So for our one, we are training from grade 1 to grade 2. So basically, grade 1 and grade 2 that the muscles should be already intact lah. So what we'll do is we can try to initiate the to try to initiate it. We'll try to giving the Faraday current. Okay, then to increase the muscle strength, basically we're giving some icing, and then maybe a suspension therapy also can be given. So, and also you need some isometric exercise along with some basic movement or some basic assisted movement also, sorry, active assisted movement also can be. So it's just basically like another thing is it's very important to give some scratching lah. So to prevent one side tightness and then another side will be going to weakness. So basically it's going to all with the strengthening and stretching method much more. I think it should be like this.
Okay, so you can also add a weight bearing techniques, that is the compression, approximation, all those techniques, so that it will also initiate your muscle technique.
Okay, noted.
Okay, then you can also add up mat activities to strengthen, to do weight bearing and joint approximation. Like weight bearing activities in prone on hands, prone on elbows. Then in sitting, you can also teach them how to weight bear on the hands. Okay, is it clear?
Yes.
Can we go to the next?
Hello, Miss.
Yes.
Yeah, for our group, it's muscle reeducation for muscle power 2 to 3. And the techniques that we can consider is suspension therapy. And then we can use tapping and stroking to activate the muscles first. And then we can also modify the fixation point to like add up to add as resistance when the muscle power is slightly improved. And besides suspension therapy, we can also use the PNF techniques as well. And also we can add in hydrotherapy. We can first do it in buoyancy assisted um, position and then proceed with buoyancy resisted position. And also when the muscle power has like gradually improved, you can also add in um, resistance training in gravity eliminated position. Yeah, so these are the few methods that we can use.
So you can use all self-assisted active exercises like wall ladder, all those things. Then you can also use some assisted resisted techniques to improve the muscle power from 2 to 3.
Okay.
Okay, next row.
Good morning, Miss.
Yes.
For our group, we'll be doing the grade 3 to grade 4 master reeducation. We are not very sure about our answer, but after a bit of discussion, we think that we can do active exercises because grade 3 it can do against the gravity, but we cannot give resisted exercises. So maybe we'll be giving like make them do like isometric exercises, like planks, or do active exercises like push-ups, or we can do hydrotherapy or even PNF. Yeah, that's all for us, Miss, because we are not really sure.
You can add up resisted exercises at this point because you need to overload the muscle to improve the muscle power from 3 to 4. So first you will start with assisted resisted exercises, then gradually you will be going into resisted exercises.
Okay, thank you very much, Miss.
Okay, so that is a major technique you will be doing. So you can do hydrotherapy. When you do hydrotherapy, you have to go for resisted. And when you are doing PNF also, you have to go for resisted. So all the techniques you need to go for resisted so that you are able to overload the muscle and improve the muscle power.
Okay, thank you, Miss.
Okay, next. Next group.
Miss.
Yes.
So our goal is muscle improve
4
muscle
to
strength
5.
4 to 5. So we choose assisted resisted exercise and also resisted exercise, and also can do through hydrotherapy, which as link biofeedback, and then PNF. That's all.
Okay, so this 3 to 5 is max. Mainly you need to add up the resisted exercises. Okay, so till 3 only you need to have lot of facilitated techniques to improve the muscle power. So from 3 to 5, you can improve through resisted exercises. That one you can choose. Either you need to do using hydrotherapy or you want to do using land exercises, or else you can also use PNF technique to do that. Is that clear?
Okay, Miss.
Okay, so here like you can use you can increase the single muscle power, or you can also do all the 5 techniques, sorry, all the muscle together. So when you are doing all the muscle together, since it is whole of right upper limb, then since it is like all the muscle together, you can do with PNF. Okay, so PNF, like we will be seeing later, so you will understand more how to do PNF. Okay, so you can use PNF, since if you want to improve all the whole of upper limb, then you can also use hydrotherapy for the whole of upper limb. Then you can also use mat activities, so that you can increase the whole of upper limb. Okay. Okay, so I think now the time is 12:35. So I'll give you 5 minutes break, then we will start with the next topic just for 10 minutes, then we will end the session. Okay. Don't sign out, you just take rest for 5 minutes, then come back. So we'll just see some of the like few of the slides from the next topic, that is proprioceptive neuromuscular facilitation. So I hope you have read your theory slides all about the proprioceptive neuromuscular facilitator. So I'm not going into the theoretical aspect. I'll just go into the practical aspect. So end of the session, like end of this topic, you will be able to demonstrate how you will be able to do all the proprioceptive techniques, then PNF stretching, then the pattern. So here, like when you say proprioceptive neuromuscular facilitating technique, you have two set of techniques. One is to strengthen your muscles. The other technique is to stretch your muscle. Okay, so you will be able to use this PNF for both stretching and strengthening. So some of the techniques are there which will be helping you to do strengthening. Some of the techniques are there which will be helping you to do stretching. So that's why this PNF techniques are used for almost all the conditions. So when you want to do stretching, when you want to do strengthening, when you want to improve the balance, when you want to improve the coordination, for all the things you will be able to use this PNF. So before going into the PNF technique, so you need to undergo a brief examination. So regarding the range of motion, muscle length, muscle power, endurance, balance, coordination, posture, and pain. So all these assessment you would have learned part by part. So checking your ROM is your muscle goniometer. So using goniometer, you will be able to like check the range of motion of a particular joint. The next is like regarding the muscle length. So muscle length is like you need to see whether the particular muscle has muscle tightness or not. So that also you would have learned in your therapeutic skills 1. The next is regarding the muscle power. So check the muscle power, you will be using MMT. So manual muscle testing. Then endurance, balance and coordination. So endurance is how long you are able to do the particular movement. So if you are able to do elbow flexion for some 20 to 30 times without any like drop in the movement, then that is called endurance. So endurance means You are able to do the particular movement repeatedly for many times. So that is called endurance. Then balance is like you would have learned now, like how to assess balance. Then coordination also you have learned in your therapeutic skills too. So how to check for balance. Posture you would have learned in your biomechanics. So all these will be coming under your evaluation. That is before doing your starting your PNF, you will be doing all this testing. Then according to this only you will be able to check your select your PNF technique. Since PNF technique will be helping in many aspects, so you need to do all these things. Then whichever is lacking, according to that you have to choose the particular technique. Is that clear? Okay. So next is treatment. So treatment will be like you have some procedures of facilitation, you have some techniques of facilitation, then you have pattern of facilitation. So procedures of facilitation you have nearly 9 to 10 procedures that we will be seeing now. Then you have something called pattern of facilitation. So pattern of facilitation is nothing but diagonal patterns, your D1 and D2. Then techniques of facilitation is like you have some strengthening and you have some stretching. So I think you have nearly 5 strengthening techniques, then 3 stretching techniques. So we will go into the treatment now. So the first is like we are going to see the procedures of procedure of the technique. So we have nearly 8 basic procedures. So you need to understand this procedures before taking going into the diagonal patterns or before going into the techniques. So for this procedure, I have a video for you to show you, demonstrate everything. All these theoretical aspects you would have already known. So now this is the practical aspect we will see. What class you have by 2 o'clock? Is it okay if I finish by 1:15 or you want to finish now itself? Because the video is for 22 minutes. So if I explain and go, it will at least take 20 to 25 minutes to complete the session. Is it okay to go with, or we will start tomorrow? Can somebody reply? Okay. Okay. So in that case, like we can end the session now. Any doubt? So okay, before tomorrow's class, can you please just go through the PNF slides so that it will be more easy. Otherwise, it will be a little difficult for you to understand the practical aspects. Okay. Okay. Thank you.